Hi, my name is Matt Melvin, and we'll be going over trauma assessment today. Once you've already done your initial assessment in your primary and you've made a transport decision, you'll need to do a full physical assessment, starting at the head and moving all the way down to the toes. Obviously, during your primary assessment, you should have already covered up any bleeding, stopped any bleeding, and assessed any airway or other circulation problems. So you will come up to the patient and you will address the head, feeling for any decap BTLS is the term that we use. You'll also be looking in the eyes, the ears, the nose, and the mouth for any fluids, any airway obstruction, CSF, anything of that nature. You'll come down to the neck and you will look at the trachea, make sure it's midline, look for any JVD, and also feel the back of the spine for any step-offs. You'll come down to the shoulders and you'll press on the clavicles. You'll come down the chest, you'll press on the sternum, you'll press on the sides of the chest, and you'll have the patient take a deep breath, then blow out. And you're feeling for any crepitus there. You're coming down to the abdomen. You're going to palpate all four quadrants of the abdomen for any tenderness. You'll come to the arm, and you're going to use opposing pressure down the arms, both sides, to make sure that there's no trauma. Then you'll have the patient go ahead and grab your fingers, squeeze real hard, okay? Check for pulses. And which finger am I touching?
Pointer.
Good. You come down to the hip, and you will rock the hips side to side. Press on the pelvis, make sure there's no tenderness there. Come down to the legs. Use opposing pressure, just like you did up on the arms, to check for any fractures. Both sides. You'll come down to the feet, and you'll check for pulses. Push and pull. And which toe am I touching?
Big toe.
Okay. Then, if your patient is in C-spine, you'll have to have a partner help you roll them. If they are not in C-spine, which will be in this case, we will have her rolled on her side so that you may check her spine. So you're going to feel down the back, make sure there's no obvious step-offs, and you'll step down both sides as well. You'll also want to make sure you listen to lung sounds. Take a deep breath. Deep breath. Deep breath. And deep breath. Good. So the mnemonic we talked about earlier, DCAT BTLS, that stands for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling.